go ahead and get started. We have a lot to cover, and I want to make sure that we're able to get through all the material in 1 hour. So thank you everyone who's joining us today. We're going to be talking about SB 803, which I see the typo, also known as peer certification. We're going to be giving you an update on the info notice that came out recently. A little bit about myself. My name is Stephanie Ramos. Some of you may be familiar with me through WISE or Access. My role at Cal Voices is a communications director. I also work on our training and education programs, on some of our resource programs, and I get to try a little bit of everything around here. I've been here for almost 16 years. I started as a youth advocate and have had the opportunity over the last 15 years to be able to work in different positions, from providing that direct peer support to supervising peer programs, providing training around those topics, technical assistance and things like that. And I work in the field because I have a sibling who has at times severe mental health challenges. And I've worked in the field so long, it's like, what else, where would I take all of this knowledge and information if I were to work in another field? And I don't know that I could pull myself away, but also recognizing that, I'm really well connected in my mental health community. I'm really well connected with the folks who run our local behavioral health system. And even with that connection, my family constantly runs into barriers and challenges when it comes to accessing care. And so if myself, my family, my sibling is going through that and we're connected, like what's going on with other people who are trying to utilize services in our behavioral health system. So I think that's what's kind of kept me around for a while. And then I'm going to go ahead and have Hannah, my co-host today, go ahead and provide an introduction as well.
Good morning, everyone. I hope you can hear me. It's really nice to join you all and see all of these messages popping up. I am actually new to the Cal Voices team. I think I'm on my 3rd or 4th month here, and it's just been really wonderful to get to know everyone. So a little bit about my background. I have a background in social work and public health, and I also have lived experience utilizing the mental health system. And prior to working at Cal Voices, I worked with exonerees, connecting them to trauma-informed care across the country. I've also have extensive experience as a navigator, social worker, counselor, within the public mental health system, as well as public hospitals and federally qualified health centers across the state. So what really brought me into this role as policy director was just really acknowledging and seeing the many barriers and systemic challenges that consumers of health and mental health services confront every single day, and really viewing that on the individual level, and then, within my own life, and understanding that there needs to be sort of a broader level systemic change that should be really informed by the community and the individuals within those systems. So I'm happy to be here today and hopefully can keep up with any questions that folks share, and great to meet you all. Thanks, Steph.
Thank you, Hannah. And I also wanted to briefly mention, as far as like questions or comments, we have about 100 people on. Open up the audio. Many of you know, if each person were to say one thing, we would take up our full hour. So if you have any comments or questions, please put them in the chat. We're going to do our best to try to answer them as we go through the presentation. Hannah is going to be on the chat answering questions there. If I see something that I think is very relevant to what's on the slide, I'll try to, if I see it, I'll try to like jump in and share that information. And I'm going to invite Hannah to do that as well. If you think something's on there that the whole benefit. Then so at the end, our other questions I haven't got to, we'll do our best answer on a little bit longer, just to make sure that you're answered. And if we can't get to every, best send out information we have at the end.
Hey, Steph, I think you cut out. I think we lost Steph momentarily. give us a quick minute and we'll see if we can get her back connected. Oh, there you are, Steph.
Awesome. Okay. So thank you. I just switched my Wi-Fi, so I hope that that helps. If anybody else has any challenges as far as hearing me, or my audio gets a little choppy, please go ahead and put that in the chat and we'll try to see if we can make some adjustments on our end. So a little bit about our WISE program. Many of you are actually, I'm sure, very familiar with WISE. That's who you probably got the email from. You've probably participated in one of our trainings or webinars or something like that in the past. It is a program of Cal Voices funded by the Mental Health Services Act and the Office of Statewide Health Planning and Development, who has recently changed their name. And our goal is really simple. It's to improve and expand peer support throughout California by helping employers recruit and retain consumers and family member staff really through workforce integration. So not only do we provide direct support to peers in the system, but we also recognize that peers by themselves can make systems change, but it's really difficult to do that if we don't have the employers and decision makers on board as well. And so we, as you know, through WISE, we have a variety of activities we're able to offer. And fortunately, this is one of those through providing these webinars. A little bit about Cal Voices, if you are not familiar, we are formerly known as NorCal MHA, so maybe you know us. We were also Mental Health America of Northern California, Mental Health Association Sacramento, might know my previous name. We were founded in 1946. We're the oldest continuously operated consumer advocacy agency in California, and we're peer run. So I would say pretty much all of our staff come with some type of lived experience with mental health. And that includes all of our executive team as well as our board of directors. So let's jump into the information that you came for. So we're going to give you a quick overview of SB 803, because for some folks, you're probably really well versed in this first part. Other individuals, maybe you're like, you're just starting to get into this topic because now it's really relevant since certification actually passed. So we want to just give you some quick, like, here's some background information before we get into the info notice. So SB 803 was introduced in January of 2020. We've had similar bills introduced prior. So in early 2015, we had SB 614. We also had SB 906 as well as SB 10. And those bills had not passed. So this is the first peer bill that has out. Hold on 1 second.
Like every sentence.
Got
I
it.
was just like, that's why I was freaking out.
All right, I'm back. Oh, turn off the video. All right, I'm going to turn off my video. So I hope that helps, and I apologize because so I hope that this helps. Let me know if you continue to have any challenges. So the SB 803 establishes a statewide peer certification demonstration or pilot project. So it's just important to note that this is a pilot project, right? So we don't know what this might look like in the future, but this was really just to get it rolling. It identifies the core competencies and educational requirements for certified peer professionals. It allows certified peers to bill Medi-Cal for certain services. And in this case, which is different than previous bills, is that it passes the responsibility on to the counties. So in previous bills, the idea was that the state would create a statewide peer certification. And what we've heard from the different players was that part of being able to get this bill passed is that the counties would take on the responsibility of doing the certification. And what we've heard from the County Directors Association was that this was really important to them. They really wanted this bill passed, and in order to do that, they had to compromise and take on the load of implementing peer certification in each of their counties. And if you are interested in the bill, you can find more. You can find the actual bill language at leginfo.legislature.ca.gov, and you'll just type in the search SB 803, and it should take you straight to the bill language.
Also linked in the chat too.
Thank you, Hannah. So what will certification do? So it'll include a certified peer support specialist as a Medi-Cal provider type. So lots of folks have provided peer support and some have even billed in the past, but they're often billing under rehabilitation codes or other codes. So this actually creates a specific provider type for peers in the Medi-Cal system. It includes peer support specialist services as a distinct service type in counties that opt into the demonstration or pilot projects. It develops and implements one or more billing code, reimbursement rate, and claiming requirements for peer support specialist services. And it increases the diversity and effectiveness of the behavioral health workforce through the use of peers with lived experience. And as many of you know, there is, our systems have always been trying to work harder at diversifying the workforce, right? And we know that the higher up we get, sometimes there's less diversity there. And we found that peers bring a lot of diversity in their experience, but from maybe the culture that they're from, other communities that they may be a part of, like the LGBT community. And so another way that we're working to really create more of an overall diverse workplace. So in the bill, it identified a list of things that DHCS needed to do, right? So these aren't necessarily that the counties would need to do, but these are things that DHCS would need to do in order to get peer certification rolling. So they need to establish requirements for developing a certification program, define qualifications, range of responsibilities, practice guidelines, and supervision standards, determine curriculum and core competencies, specify training requirements, establish a code of ethics, determine continuing education requirements, determine the process for initial certification issuance and renewal. They also need to determine a process for investigation of complaints and a corrective action, including suspension and revocation of certification and appeals. They'll need to determine a process for an individual employed as a peer support specialist on January 1st, 2022. So this is again the grandparenting, and we're going to go over this information. And they need to determine requirements for peer support specialist certification reciprocity between counties. So if somebody, is maybe they're working in Lake County and they decide to move to Placer County, how is that certification going to be valid across counties, and if somebody comes from out of state? So we're going to jump into the info notice, but I just want to ask, has the audio improved at all? I'm crossing my fingers here. Audio keeps cutting out. Yes, better. Still a little choppy. Okay. Let's sent out. We will work on getting that sent out. Some people are saying the audio is smooth, some saying it's on and off. So I'm trying to think the best way to proceed.
Steph, I'm happy to take over presenting if you want to do the slides.
Okay.
Until you get your audio back. Would that be okay?
Let's do that.
Okay. When your connection is stabilized, feel free to jump back in. Can everyone hear me? This is Hannah talking. Can you all hear me? Hold on. Moving so fast here. Okay. All right. So until Steph comes back, I will just go ahead and present for you all. All right. So I think Steph can go ahead and share the info notice, which will be informing all of this information. But we'll start with one of the sort of elements that was laid out in the certification requirements. So this shouldn't be too surprising, as it's based off of a lot of the other peer certification requirements that are pre-existing. To read them really quick, you have to be at least 15 years of age, possess a high school diploma or equivalent degree, self-identify as having experience with the process of recovery from mental illness or substance use disorder, either as a consumer of these services or as a parent, caregiver, or family member of a consumer. Be willing to share your experience or their experience, have a strong dedication to recovery, agree in writing to adhere to a code of ethics. Steph or Blia, if you wouldn't mind just quickly popping that in the chat, the code of ethics, I believe they're from Mhsa. Successfully complete the curriculum and training requirements and pass a certification exam. And so we're gonna expand a little bit on the training and certification pieces later on, because I know those are absolutely important. So next slide, please. And Steph, let me know if you want to tag in. Either way is fine.
So I took the advice of the group and I called in. So I'm wondering, is that better, Hannah?
You sound better to me. I don't know. Okay, folks. Okay, all right. So we'll tag this.
It sounds like I'm better.
You all have been so patient with us. Thank you so much.
Yes. Okay. So I'll go ahead and jump in. Thank you, Hannah, for your support, and thank you, everybody, for your patience. So in the bill, as well as in the information notice, they identified the certification curriculum. So the training curriculum needs to incorporate core competencies. However, it doesn't at this point define, well, what does that competency mean, right? As far as like looking at, if I develop a curriculum around one of these topics, what details need to be provided in that specific topic? So the curriculum will include the concept of hope, recovery, and wellness, the role of advocacy, the role of consumers and family members, psychiatric rehabilitation skills and service delivery, and addiction recovery principles, including defined practices. It'll include cultural and structural competence training, trauma-informed care, group facilitation skills, self-awareness and self-care, co-occurring disorders of mental health and substance use, and don't worry, there's 8 more. It'll also include conflict resolution, professional boundaries and ethics. The certification curriculum will also include preparation for employment opportunities, including study and test-taking skills, application and resume preparation, interviewing, and other potential requirements for employment. It'll also include safety and crisis planning, navigation of and referral to other services, documentation skills and standards, right? We may be billing, so we'll need to ensure that we know how to do that. It'll include confidentiality as well as digital literacy. One of the questions in this chat, somebody asked if this is for national certification or only California. This curriculum would be for the California certification. So in the information notice, there's different enclosures. There's a lot of information in it. And so we were really going to just focus on enclosure 1. And that is the standards for initial certification, biannual renewal, lab certification, areas of specialization, grandparenting, state and county reciprocity, as well as complaints and corrective action. There is additional information that you'll see on here that you are welcome to go to the info notice and read about that as well, but it's too much information to include in a 1-hour webinar. So we'll look at providing future webinars where we might be able to provide additional content. So I mentioned what we'll talk about in this enclosure, and we're going to go through each of these items so that you'll have an idea of what the information notice is providing. So the first piece it addresses is initial certification. So for initial certification of a peer support specialist, a Medi-Cal peer support specialist program, so the program that is basically operating the certification, is they need to ensure a candidate agrees to adhere to the Medi-Cal Code of Ethics for Peer Support Specialists. And I'm going to ask Hannah to put the link to that in the chat. Some folks are familiar with the ethics of peer support, the ethical guidelines for peer support workers through INAPS, the National Association of Peer Supporters. This is different. So this is not that same list. So you'll want to make sure that you check this out. Also, as part of the certification program, the program must ensure a candidate has completed the training curriculum that includes 80 hours of training. So previously, there were there really wasn't a required number of hours anybody needed to be trained because we didn't have a certification. And different certifications for, obviously different jobs have a different number of hours. And there was a big conversation about, well, how many hours is enough? And so in this case, they're going to be looking for 80 hours. And this is for folks that are coming in new, right? Because I haven't got to grandparenting yet. So I'll let you know about that shortly. They also need to ensure that the candidate has passed the initial certification exam. So there will be an exam. We do not know the details of that, but that will be part of the initial certification. So you got to sign the code of ethics, take an 80-hour training, and pass an exam. So the second piece the information notice addresses is the biannual review. And I want to mention that there's not a lot of information yet on each of these things. This is just what has come out so far. And so certification programs are going to be using this information to develop their program. So for biannual review, this is basically like, how do I as a peer, once I'm certified, how do I renew my certification every 2 years? So keynote, every 2 years, right? You're going to need to renew your certification. So the program that's providing certification needs to make available continuing education trainings. And candidates who are seeking to renew need to perform 20 hours of continuing education. So over a period of 2 years, you need to have taken 20 hours worth of training. And that needs to include updates on any applicable laws and evidence-based practices. And we need to ensure that our renewal applicants are, again, reaffirming in writing, so probably a signature, you're signing the most recent version of the Code of Ethics. So the next thing that the info notice addresses is the lapse certification. So let's say that 2-year renewal comes up and you miss it, or you forget, or something goes on. Maybe you're not working, or maybe it's not relevant at that time for you, and you missed your recertification process. If that happens, and it's not within it needs to be within 4 years of when your certification was due, which is a big window, right? So let's say I missed my certification 2 years ago and it's been 3 years, I can still renew. But I need to have completed a 40-hour refresher training. So if you missed your 2-year certification renewal, it's within 4 years, you need to take a 40-hour refresher training, take the exam again, and affirm in writing the most recent version of the Medi-Cal Code of Ethics. So again, you missed your recertification period. It hasn't been 4 years yet. You're going to have to take a 40-hour refresher training, pass the exam, and sign the Code of Ethics again. So the next piece that they address in the info notice is areas of specialization. So once certification kind of rolls out, by January 1st of 2023, the certification program needs to implement curriculum for specialization. So that would include parent, caregiver, and family member peers, crisis services, forensics, so this could be for justice-involved individuals, homelessness, and they may add additional specializations later on. So these areas of specialization are in addition to the 80-hour training for initial certification. So let's say somebody comes in new, or maybe they, missed the opportunity to grandparent in, which we will get to shortly. Then they're considered like a new peer, right? So they not only do they need to take the 80 hours course for becoming certified, right? But if they want to specialize, in addition to those 80 hours, they can take other classes or attend another curriculum course in order to quote unquote specialize. Now, in the info notice and in the DHCS, on the DHCS peer portal, they have some frequently asked questions. And one of the questions there it asks, are peer support specialists who work in a specialization, such as a parent, a caregiver, a family peer, are they going to be required to complete the area of specialization training in order to provide peer support services? So it's basically asking, if I get certified as a peer and I'm a family advocate, do I also have to do the specialized training? And the answer is no. So a county opting and developing a program either through a designated entity or their own approved program, they have to make training in the areas of specialization available, but the state isn't requiring that those individuals complete this training before they're able to provide the Medi-Cal reimbursed services. And so although it will be offered, it's not necessarily a requirement. Although the counties might elect to require specialized training for specific populations. And so, I mean, obviously it would be ideal if folks are serving certain populations that they get specialized in that area, but at this point, it's not necessarily a requirement. So any questions so far on what we've covered? I know Hannah's been monitoring the chat. I've been trying to, if you have a question, put it in the chat. So question, will Cal Voices or WISE be one of the training organizations? As of right now, we do not know. So we have applied to be a training organization, but at this time, we do not know the status of our application or how that process will be moving forward.
Hey, Steph, we have, thanks for answering that. We have 3 folks who have raised their hands. I don't know if you want to take those questions at the end or right now, totally up to you.
Yes, so let's take them as of right now at the end, because I don't know how to address the hand raising because of the platform that we're on right now. Somebody asked, are there any language specializations? At this time, no, but that does not mean that won't happen. Another question was, how do you apply as an organization? So Lily, is your question, how do they apply for what? I guess would be my question. And if you could pop that in the chat, I'll get back to that shortly. How can we sign up for forensic training? So these trainings are not yet, as far as for certification, specialized trainings have not been developed yet. So these need to be developed as of January 1st, 2023. So hopefully we'll have more information available at some point. We'll share that if we get it. Can I still get certified with trainings I have this fall? I'm going to get to that, Cynthia, so just hold tight. Let's see. Somebody asked about transferring certifications to different counties. I'll get to that in grandparenting. Will people receive a copy of the slides and links? We are going to post that to our website, so we'll let you know where that's available. Folks are asking if previous training is applicable to certification. We will get to that shortly. Lily asked, so how does the agency apply to be able to train staff? So that, from my understanding, the applications were due at the end of August. So at this point, the application for that is closed. I do not know what the future holds, right? So that may change. And as of right now, it doesn't appear that there are a lot of certification programs. And so the certification programs out right now, the main one is going to be through Mhsa, and they're the ones who have solicited training. So I don't have much information beyond that. Hannah, Nod, do you have any information beyond that? No. Okay. Let's see.
Yeah.
Do I know whether?
Sorry. I see a question about WEX. I'm not familiar with that. I don't know if you're able to provide some more information about that. That would be great.
Oh my gosh. Okay, so if folks can clarify, I see that there are more questions. I'm going to keep going, and then we're going to come back to the questions because we might have some answers, and then we'll come back to the questions at the end, just so we can make sure we get through all the material.
And I'll try and also get through each of them as you go, Steph.
Great, thank you. And thank you, everybody. So grandparenting, I wanted to jump in to grandparenting because I feel like some of the questions this would be relevant to. So the grandparenting is for individuals who are employed as a peer as of January 1st, 2022, okay? So if you're a peer right now and you're still going to be employed as a peer on January 1st, this would apply to you. So in order to be grandparented in, you need to have 1 year of paid or unpaid work experience So they want 1,550 hours as a peer specialist, or have 1,550 hours in the past 3 years, with 500 of those hours being completed in the last 12 months. And you need to have had 20 hours of continuing education, including law and ethics. Now, I will say that's all that's in the info notice, so we don't have a lot of clarification beyond that at this point. So number of hours and ensuring that you have been kind of keeping up with training. So number of hours training, and you need to have completed a peer training. Okay, so think of this. As of January 1st, 2022, you've been doing the peer support, you've been maybe getting continuing education along the way, and you need to have completed a peer training. So if you've gone through WISE-U, somebody asked, if you've gone through the DBSA training, you've already gone through a training program. As of right now, today, in this moment, it seems like that would qualify. You also need to complete 3 letters of recommendations as outlined. So you need to get 3 letters of recommendation, one from a supervisor, one from a colleague or professional, one self-recommendation describing your current role and responsibilities as a peer support specialist, and pass the Medi-Cal peer support specialist exam. Okay, so in order to get grandparented, you need to have the number of hours. You need to have been doing continuing education. You need to have completed a peer training. You need 3 letters of recommendation, and you still have to take the exam. So I know a lot of folks have been really, we were wondering for a long time, am I going to have to take an exam? Do I just have to have training? So it looks like it's going to be both. And at this point, it doesn't look like they have necessarily specified which training you would have had to have gone to. It just says that you need to have attended a training program. So if you have done that, I would just, make sure that you're collecting your training certificates, that you have the information you need to show that you did attend some type of training program. So somebody asked, like, what if I've done all the trainings, but I haven't been working as a peer? The language states individuals who are employed as a peer as of January 1st, 2022. So you want to make sure you're employed as a peer as of January 1st, 2022. And we don't have a lot of information beyond that at this point, because we're just going based off of what is offered in the info notice. Where do you access the exam? We don't know that information yet either. And the thing is that right now the certification programs are being developed. So they're not even at a point yet where, has the exam even been developed at this point? Have they identified the questions? Like, all of that is still to be determined at this point. Let's see. All right, I'm gonna keep us going. And I'm gonna come back to the questions. I just wanna make sure we get through the material. So in order to get grandparented in, you need to complete or begin the grandparenting process by December 31st of 2022. And somebody's going to ask, what's the process? And we'll say, we don't know. Because again, these are all things that are being developed, but these are just kind of dates to keep in mind, keeping a lookout, trying to make sure that you're staying up to date with information. After this date, so January 1st of 2022, you're employed as a peer. As soon as that grandparenting process comes into play and is available, you want to start it. Because after January 31st, 2022, if you have not began or completed the process, you are basically starting over as if you're a new peer trying to get certified. So that means instead of attending a peer program, you now have to attend an 80-hour approved peer certification program. And peers with out-of-state certification. So if somebody, let's say they're certified in Michigan and they move to California, they don't have a date like that. They don't really have a cutoff date. But again, if you're here in California, don't have a state certification outside of California, then you would be starting over if you do not apply for the grandparenting process by December 31st of 2022. So somebody just wanted me to confirm a date for grandparenting, and I'm going to jump in here and make sure that I can confirm that that date is correct. So grandparenting will be offered to individuals who are employed as a peer as of January 1st, 2022. And if somebody is employed on that date, they need to complete the peer certification grandparenting process. So it says that they must complete or begin the process by December 31st, 2022. So it'll give you a year to at least start that process. So we talked about the grandparenting if you are employed. We talked about if you're coming from out of state, you can get grandparented, same requirements, but you're not going to have that deadline that you have to do it by. Now, if you're in a county that has a peer certification program and you go to another county, so those are what we're going to talk about now. So the peer support specialists who are certified through a DHCS approved peer certification program will be recognized in all counties throughout California. Okay, so again, if I get certified in a peer training program in LA and I move to Sacramento, they're going to honor that peer certification. However, let's say that one county does not elect to participate in the Medi-Cal peer benefit. So they're not doing the peer certification program. They can't just start collecting peers that are already certified and then start having them bill as a peer. So I'll read this just to make sure it's clear. Only counties electing to participate in the Medi-Cal peer benefit will have the ability to be federally reimbursed for behavioral health peer services. So I know for a lot of you on the line that might not be of too much interest, but just for counties to kind of keep that in mind. So there are still some concerns, right? And just some things that aren't totally clear. So will all peers need to be certified, right? Well, that's like I don't know, right? Well, does an agency want all their peers to be certified? Well, to bill for the peer support services, then yeah, they would need to be certified. But if I'm not working in a program that bills, maybe my employer doesn't care that much if I need to be certified. Some folks have concern around co-optation and clinical supervision. And in the recent info notice, and we're not going to go over that today, but it is in the info notice that folks don't necessarily have to have clinical supervision. They can be supervised by a peer. They can be supervised by someone who isn't a clinician. So, and there's actually some more questions in that area, but I'm not going to go down that route because that could become a whole webinar in itself. Will billing limit services, right? Some people are concerned about that. You know, if I have to, if I work somewhere and I have to bill for a certain amount of minutes or hours, are there things that I was doing that I thought was helpful for clients that I can't bill for? Are agencies prepared, right? What does our organizational culture look like? How well are peers embedded in our programs? Do supervisors and managers understand the peer role when they're writing job descriptions, when they're evaluating peers? Do my colleagues, clinicians, social workers, case managers, do they understand what the peer role is, right? When I'm coming into this, maybe I'm coming into a new program or a new agency or a new county that's starting to implement peer programs. Who's going to pay for peer certification? So this really hasn't been clarified. If I'm a peer, right, there is an assumption that there will be certification fees. Do I need to pay for that? Does my employer need to pay for that? So that we don't know yet. What will the certification exam look like or continuing education look like? We don't know that at this point either, so there's some concerns there. And what about revoking certification? And that's a process that is, it's going to have to be developed. So those are kind of some unknowns that we are still unclear of at this point. So Hannah, was there, I kind of want to go through the chat and see if there were any, I did see a question around the national certification, and folks asked if they would be grandparented because of that. And I would say if you have received the national peer certification, then you probably meet the training requirement, but you would still have to follow the grandparenting process. So you would still have to obviously show that you have the training, you have to have worked the amount of hours, you would need to get the recommendation letters, as well as take the exam and sign the code of ethics.
Yeah, Steph,
does volunteer, go ahead. Go ahead, Hannah.
Working through the Q&A right now, and I'll get back to the chat in a second. Someone asked about law and ethics. I did share a link for the code of ethics. When it comes to law and ethics, I don't know if that's one of the core competencies, but I'm not aware of any resources on law and ethics.
So that has not been clarified as well. I've seen it, but I haven't found any documentation or information out there of what they actually mean when they're saying that. And I would say I would assume law and ethics as it applies to peer support, or are we talking about patients' rights? Are we talking about, what is they referring to at this point? It's unclear. Bina asked, if you're a family or youth advocate for Sac County, are you qualified as a peer specialist, even though your job title is not a peer specialist? So it's not so much about the title, it's about the duties of your role, and does your job require you to have lived experience? So that's typically how we have at Cal Voices, how we've looked at, well, what is actual peer? It's about being in a peer role. Now, somebody could be a recovery coach, they could be a peer specialist, they could be a youth advocate, a family advocate, a parent partner, a youth partner. There could be a variety of titles, but it's more, does the scope and role and lived experience align with what the peer certification is intending to certify? So Hannah, do you know this? It says, how are counties informing DHCS they're electing to opt in to bill with peer codes?
So thanks for asking that. We've also asked that a couple of times. So because this is an optional benefit and counties can decide if they want to participate or not, there were sort of two processes that they needed to engage in. Number one, they had to inform Cal Mesa and DHCS if they wanted to participate in the Medi-Cal billable, certifiable peer support program. And then they also had to opt into the process of either creating their own training and certification or using Cal Mesa's. So we've asked a couple of times which counties have communicated, number one, if they're participating, and number two, if they're creating their own certification and training process. And unfortunately, we're not aware of which counties have done that, but it seems as though that's been sort of a direct communication between Cal Mesa and the counties in terms of if they're participating and then how they're going to do their training. So I know that doesn't really answer the question, but I know by early August, they had to opt out of the Cal Mesa one and let them know that they were going to do their own. So at this point, we should know which counties are participating, but that hasn't been released on a public platform, if that makes sense.
Totally. So another question was that, will multiple agencies be authorized to provide the training program, or will it be centralized to one agency? So from what we were able to find, there was a request for qualifications that went out for organizations to apply to be a certified training program for the Cal Mesa peer certification program, which a lot of counties opted into. And the option said that they will either select an entity, which tells us usually one, right? Or they would pick the most qualified organizations to submit proposals. We also went into the Cal Mesa board meeting minutes, and there was a presentation done, and the person that was presenting said that they would pick 1 to 2 training programs. So for us, it's still unclear. Is it 1 to 2 programs to develop the curriculum, to provide the curriculum? Is it 1 to 2 agencies that they're going to be the only agencies that anybody can go to get training? That is still unclear. And for us, at least at Cal Voices, that's a concern because there's a lot of peer-run organizations who provide peer support training. And what happens to all of those programs? So that could be a whole discussion. If you have concerns about that, we really encourage you to reach out to us at Cal Voices because it is a concern of ours, and we want to be really supporting our peers, our peer organizations out there that have been doing this work for a really long time. Somebody asked if we do get certified, about coordinating for training. Of course, I think whoever gets certified as a peer training program is going to need to be, really connecting and coordinating with all the counties out there. So I cross my fingers we get to, but we'll see how that plays out. Somebody also asked if folks can get trained to be supervisors. Yes, and again, it is unclear how that will roll out. It looks like Hannah, is it the DHCS or Cal Mesa will be developing a peer supervisor training? Do you remember?
I believe it is DHCS that's working on that.
DHCS. Okay. So it looks like there will be a peer supervision training developed. We just have not gotten there yet. Somebody asked if the 1,550 hours can come from multiple organizations if you volunteer as a peer. Nothing said that it couldn't. So I would assume, yes, it would be like collective work hours that or at least collective peer support experience that you have been providing.
So there's a question here from Mia Cooper. If FQH, I was typing it, but maybe it'll be faster. Yeah. If FQHCs are looking to hire peers, what does this look like in the M2M context? Can FQHCs hire county certified peers? So Steph, the way I'm interpreting this question is yes, they could hire Medi-Cal billable peers. That this program, this SB 803, isn't necessarily tethered to the counties. It could work in different contexts and different settings, as long as those settings have the capability to bill Medi-Cal. That's sort of the big benefit here. Is that how you would interpret that, Steph?
Yes, I would interpret it the same way.
Okay, and then Mark Parker asked, my internet cut out while you were explaining what the Cal Mesa RFSQ, could you possibly repeat?
Yeah, so real quickly, Cal Mesa put out a request for statements of qualification to provide peer training. And in the RFSQ, it said that they would be picking an entity to provide the training, or that they would request proposals from the most qualified organizations that submitted the request for the statement of qualifications. And in the board meeting minutes for Cal Mesa, there was a presentation where somebody had said that they would be selecting 1 to 2 training programs. Now, we don't know if that means 1 to 2 training programs to develop a curriculum that agencies can use, or if that means 1 to 2 training programs that anybody who wants to be certified would have to go through in order to meet the training requirement. Somebody asked, would there be any benefit to pursuing national certification versus the California state certification? It's a complicated answer, but in short, the state certification is like the basic, it will become the basic standard certification to be a peer worker. So entry level, no matter what level, you have to have that certification. The national certification available through Mental Health America and the Florida Certification Board is an advanced certification. So with that certification, I think you need to have worked 3,000 hours, completed a peer training program, taken an exam. But the idea is that your training would be on advanced topics. It's really showing that kind of like you've been doing this for a while, you have the experience, you might be further along than an entry-level peer. So, I mean, I think it looks great on your resume. We have some contracts with private mental health providers and private hospital systems that prefer and actually really only want to take peers who have become certified at the advanced national certification level. So I would say, especially if you're looking at getting into the private sector, that would be beneficial. But I would say that at the very least, you would still need the California state certification. Let's see. I'm sorry, we're still going through the questions, trying to see if anything in here we haven't answered. Hannah, do you see anything we haven't gotten to?
Yes.
Somebody asked. Oh, go ahead.
Sorry, I just answered it in the Q&A though. Someone asked about information on pay rate requests. Requesting counties will be opting in to provide Medi-Cal peer support specialists and the DMC ODS rates. I haven't seen anything about the specific rates. I think I was just saying, and you know, anyone else who wants to chime in the chat here, if they know something more, that they're in the process of submitting the waivers to CMS, the federal Medicaid services, and hopefully we'll have more information soon, but I haven't seen anything on that yet.
Okay. And I just want to put out there that like we're providing information on what the info notice says, and there's a lot of like details that have not been ironed out yet. There are details that have not been publicly released, and so on our end, we're doing as much as we can to try to find that information. And I think as we find information, we want to continue to do these webinars to kind of share people with everybody, kind of like what are the most recent updates, what are we finding out, how do you get started. But for now, we've gotten the info notice to provide guidance to the certification programs on kind of like what processes are required, what are going to be the different requirements for certification to help them develop those programs. Somebody asked, who is going to help this certification keep the integrity of being a peer and not turning peers into case managers? And I think that is a concern, right? So some folks talk about co-optation of peers, like peers, how are they losing their peerness? And I think that's really, I think a major contributor to that, whether folks lose their peerness or whether they maintain and strengthen their peerness, is really, you know, organizational readiness. Do agencies understand the peer role? Do the supervisors and managers understand the peer role? Are they reinforcing the competencies? Are they reinforcing the ethics? And so that, I think the biggest impact on that will be the organizations themselves who are employing peers. At Cal Voices, we are really, at least in the next few months, we want to start implementing kind of peer worker support webinars where folks can come in and really connect with other peers to not only provide support, but really to that note, like connecting with folks who are doing this role to help us maintain our peerness. And we also provide training and technical assistance to peers and employers. So, you know, if there's any employers on here, we'd be happy to work with you and provide support and ironing kind of all of those things out, right? Like organizational readiness, employee evaluations, supervision, things like that. What is our contact information? Okay, I'm going to go through the next couple slides to get you to our contact information, and then we're going to keep rolling through the questions. If you have questions for DHCS or Cal Mesa, you want to jot this information down. So if you have questions in regards to implementation of SB 803, you want to email peers@dhcs.ca.gov. And if you have additional information or questions regarding to Cal Mesa's role in peer support specialist program, then you can email Cal Mesa at peercertification@calmesa.org. And I would even say, like, if you want to CC our team on those emails, that would be awesome, because we're trying to get as much collective feedback from the peers, from the counties, from the supervisors, managers, the nonprofits, everybody that's doing this work, so that we're trying to set up regular meetings with DHCS, with Cal Mesa, with counties, all the decision makers, so that we could be informing them of like, what are our actual peer certification stakeholders? What are they saying? What are the issues they're identifying? What are the concerns? So I would encourage you to, you know, I'm like CCS, we'd be happy to kind of just keep in the loop of what is going on. If you need peer training and you're like, oh my gosh, I want to hurry and get a peer training before the grandparenting starts, we encourage you to check out our WISE-U program. It's a full service peer program. It's 77 hours. We do career counseling. We do job training. We help folks find opportunities for field work. We'll help you with your resume, things like that, to find a peer role if you've been out of the field for a little while. It's free. Right now we're doing it virtually, so wherever you are, you're welcome to sign up. So you can check that out at wiseup.work. I also want to share with folks that we have a private Facebook group. And this is for folks who are working in peer roles in the public mental health system, or maybe you've just finished a peer training and you're trying to get into one of those roles. We invite you to join our peer group. It's not for managers, supervisors, or organizational leadership, but it is really for those of us working in those peer roles. And it's been helpful in sharing information about self-help topics, developments on the peer workforce, connecting with other folks and creating kind of your peer professional network, sharing input and views on like what are important issues related to successful and sustainable peer employment. We share job opportunities on there. So if you have interest there, go ahead and jot this down, www.facebook.com/groups/wise peer professionals. It's going to ask you two questions. It'll say, do you work in a peer role? Do you use your lived experience in your role? You just answer those questions, and that just kind of helps us to filter to make sure that the folks coming in are actual folks in peer roles or wanting to become in a peer, to move into a peer role. Here is our WISE contact information. And this is for the WISE program in general, and we're checking this regularly, whether folks have questions about peer employment, whether it be for themselves or as an employer, or if you're interested in the Peer Training Academy, that is how you can get a hold of us. I would say email is the most effective right now, since there's some days folks are still working remotely. So I would encourage you to check that out. So I'm going to go back into the chat. Hannah, I don't know if you've seen anything that you
yes,
are looking at. Yeah.
There's one question maybe you or Blia can answer. Denise says, I took WISE-U many years ago. Is there an expiration date? Any risk of having to do a more up-to-date training? I'm not sure about the WISE-U expiration date.
So I haven't seen an expiration date as far as the certification requirements, but it did say that you need to be doing continuing education trainings. So, you know, if you can find like webinars related to peer support, if you find any webinars related to ethics and peer support, like just trying to make sure that you're keeping up to that. And as we get information about like what is going to count towards those things, we'll make sure that we get that sent out to folks. Somebody said they work in more than one county, so they need to take multiple tests to become certified. I believe no, because in the info notice, it says that certification programs are going to be honored across counties. So you should just have to complete one certification program. It looks like some of you are answering questions, which is awesome. So thank you, everybody. I also see in the chat, Hannah had put her and my contact information. You may have to scroll up to get it, but you're welcome to contact us both individually as well. There are so many questions and comments. This is amazing.
And what I am going to do is I will try and follow up with a Q&A with anything we didn't get to, but we might have, feel free to also raise your hand if you had a question that we somehow missed in the chat or in the Q&A. Please feel free to raise your hand. I know we're a little bit over time, so if folks have to jump off, that's totally fine. So Cynthia just raised a question, and it's a good one. If WISE-U peer support training is going to be a good first step. So here's the challenge is for the Medi-Cal billable peer support program specifically, Cal Mesa is going to select 1, 2, sort of unclear how many agencies to create this specific California Medi-Cal training. Now, as we mentioned before, Cal Voices did apply to become this training entity, but we don't know yet who has been selected. So until this is sort of fully rolled out, yes, feel free to enroll in WiseU. It would likely help you with the grandparenting process so that you don't have to do the full training when SB 803 peer certification is rolled out, if that makes sense. You would still have some sort of hours stocked up from another training like WiseU or perhaps another training program. However, until Cal Mesa selects their particular agency that's going to lead the training, it's really unclear sort of who you should be training with if you want it to count for that. But for the grandparenting process, those hours can help you sort of qualify for, I would say, like a reduced process. So you wouldn't have to do the full training to become peer certified through the Medi-Cal SB 803 program. I hope that makes sense.
Awesome. Somebody asked, how would they know if their director submitted the form to opt in? At this point, I would say you would have to ask them, because we've asked Cal Mesa directly if they have a list of counties that have opted into their program, and they say it's not available. And then if individual counties decided that they wanted to create their own certification program, they would have had to communicate that directly to DHCS. So I would say asking them is the best way to find out that information. Any other questions folks want to put in the chat? I know people are raising hands. Hannah, have you figured out how to?
Oh yeah, Blia is going to help us with that function. So yeah, feel free to, I think Dawn raised their hand. I don't know, Blia, if you can. Yeah, okay. Dawn, are you able to unmute? Maybe not. Let me see if I can figure that out. Oh, there we go.
Hello.
Hi, Dawn, we can hear you.
Hi.
Hi, Dawn.
Hi. Well, it appears this is a separate entity than the one that I was thinking, the WACS program. This is a different entity. So I was just listening.
Okay.
Were you asking about WET, like workforce training?
Yes.
Oh, okay. Okay. Yeah.
Yes.
Because I was trying to Google what WEX was, but I wasn't sure. Yes. So this is a different process than the WET process. This is for the sort of Medi-Cal certifiable peer support specialist program that's going to be rolled out across the state. That the current WET training programs is kind of what's, and Steph, you can correct me if I'm wrong. That's sort of what we have in motion right now, where you could do training with various different entities. I think Cal Voices is one of them. So this is a little bit different. Yeah.
Okay. Yeah. Now I was clear. Once I listened on, I knew that it wasn't the same entity. Thank you.
And counties may decide to use some of their WET dollars. I mean, they might say, hey, we want to use some WET dollars to help pay for certification fees for our peers. Like counties may utilize some of that funding to support the peer certification. I think that would be county by county though. So at this point, we're not quite sure how that would work.
I appreciate it. Thank you.
Absolutely. Somebody asked what's going to happen with MHSA funding. I think as of right now, things are still, I don't think that this will really impact MHSA funding, although I would say that counties might look to start developing more MHSA funded peer programs now that peer certification has started, but I don't know how it would affect the funding itself.
So Jared also raised a really good question, and I haven't seen any specific information on this, but they asked for hours for grandparenting. Would we just need our supervisor to sign off on our hours? I think that's a great question. And I haven't seen any specific guidance on that in terms of how you would specifically present the hours, because obviously you have to get the letter of rec from a supervisor, but that would be my guess. But again, sorry, go ahead.
And so I know that with the national certification, you have to upload your training certificate. So that's why part of, if you're going to look at grandparenting and let's say you attended a training program, find your certificate. If you can't find it, start reaching out to the programs that you did the training with, just so that you have that information once the grandparenting process becomes available.
Okay. I know we have a raised hand from Carla. Steph, did you answer Catherine's Q&A? Is this why agencies
Yes.
You did. Okay, that's what I thought.
Yeah.
Okay, so Carla, if you'd like to unmute, feel free.
Hi, yeah, I just wanted to share that I put this in the chat, but for the Southern Counties Regional Partnership, which covers all the 10 counties in Southern California except for LA County, we do have wet money through the partnership grants that have just been issued recently within the past year. And we do have in our plan to provide stipends for peers that are in training, and will probably, and also covering the training. So there is wet money that's going to support the peers in their training and the certification process.
Thank you, Carla. And you're always such a wealth of knowledge. So I'm so happy that you're on this call with us. And it looks like, I didn't see, are there more raised hands or are we? It looks like we answered the Q&A. We've gone through most of the chat. Is there anything else folks are interested in? And looking at the timing, I'm thinking that as we do future webinars, we might want to schedule them for a little bit longer since there's so much interest. And just for folks to know, we are looking at providing some type of webinar going forward quarterly. So, if a bunch of information comes out and we're like, oh, people need to know this, we may do them sooner, but definitely, keep a lookout for our webinar announcements because we want to make sure we're getting information out to peers and employers as quickly as we can as, as new things are and new updates are coming out.
I just want to make sure we get these last couple of questions. Amelia asked, hi, Stephanie. I have the folder that we did with you. Is this still a good source of studying? So folks have gone through WiseU, some folks have gone through our Advanced Peer Training Academy. I would say, as far as studying, I think a lot of training that folks have gone to would be relevant, but because we don't know, like the exam hasn't been, the exam hasn't been developed yet. We don't know if there'll be a test taking prep guide. So I don't want to tell anyone to go down a certain route as far as preparing yet because that information hasn't been made available yet. But once it does become available, that's information we're going to come back and provide another webinar and share that information with folks. Awesome. So the last question I think we have time for today is there money to help with getting your renewal for national?
So with SB 83, no, because this is just addressing the state certification. I don't know if there is funding through other sources, at least we've been looking and we haven't found anything to help pay for the national certification fees at this time.
Okay, I think we got, someone asked, what does RELIAS stand for? I think someone else shared that. It might be a training or peer organization. Whoever shared that, feel free to pop that information in. But we are going to probably wrap up here. As I mentioned, we're hoping to do subsequent trainings, webinars, as more information about SB 803 and training and certification becomes available. I know we couldn't answer all of the questions, but we just want to make sure we're only presenting on information that's publicly available so that we know you're getting sort of the right data. But we've also offered our WiseU and Cal Voices emails, so feel free to reach out with any further questions and keep an eye out for future webinars. And we just wanted to thank you all for being so wonderful, participating and being engaged, answering questions, asking questions. It's been really great to share this time with you today. I don't know, Steph, if you had any other comments before we let folks on to their day.
I would just say, we'll make sure you all are on our distribution list. And then as we get information and we're able to provide webinars or information, we'll make sure that we're getting that all out to you as soon as we can. But like Hannah said, thank you so much for getting on here. I'm super excited about this. I think a lot of folks have been waiting for this. And so we'll do our best to keep you informed. And thanks for your patience with my Wi-Fi, because we'll learn as we go. Someone asked if there'll be an update, another webinar for updates in the future. Absolutely. So keep a lookout for our webinars and info updates, and hopefully we'll see you all in the next one. All right, thanks everyone. Have a good rest of your day.